are here. But I keep trying. We had a really fun evening in the Zambian High Commissioner last year, and we'll probably try and do that again this year or early next year. But the real message is a huge thank you for the continued support. As I say in the various thank yous I send out, the fundamental problem of a very small charity like ours is the difficulty we have in actually keeping the business going, if I can call it that, in the sense that it's not quite easy, but it's relatively easy if you have a specific thing. Sorry about the buzz on this. Here or here? Yeah? Okay, thanks. If you have a specific initiative, as we did in COVID, to raise money for washing stations, that was relatively easy to raise, but actually just the pedestrian apparently, oh, you're just supporting these guys, doesn't click. And as a consequence, it's very difficult. But the 1,000 Club is absolutely fundamental to the core. It provides between 25 and 35% of the running costs of this little business. And call it a business, just to give you a perspective, it's about 150 to 200, between 150 and 200,000 pounds a year to keep the machine going. There are staff in Zambia. There's all of the connectivity, IT connections that we have to make, and we just need that underlying reassurance so that the guys who actually run the business don't have to keep looking, where's our next salary coming from? So it's a huge thank you, and if I can, I'd like now to introduce you to Nagib, who is our chairman, who's doing with James, who's our CEO there, an absolutely sterling job, and they'll tell you a little bit about it. Thank you very much for coming, and thank you for your support.
Thanks, David.
And I'll limp across.
You can run if you want. Ladies and gentlemen, thank you very much for coming. And on behalf of the Virtual Doctors, as David has said, we are so grateful that you are here today. We are so grateful for the support that you give us. We would not be able to do what we do without your help. You guys who make it possible. And of course, our volunteer doctors. We are just the probably telemedicine equivalent of a dating agency. We get the people with the skill set and we connect them with the people that need them most in Africa. And we can't do that without your help. So we are very grateful for that. I've been involved with the charity for 10 years now. It started when you, the founder of the charity, came to speak at a Rotary Club at which I was visiting, and he told a very compelling story about his experience while he was out in Zambia and what he decided to do as a result of that experience. And as an African, I was born in Zimbabwe. It touched my heart, and I felt compelled by Yu's story to play my part, to be involved in the great work that was happening. And so that was my story. Fast forward 10 years, now I'm here with you all. In the time that I've been with the charity, I think we've handled about 20,000 cases. That means we have about 20,000 interventions. Our volunteer doctors have assisted with treating or providing treatment advice to 20,000 patients. Now, I won't stand here and say we saved every single one of those 20,000 lives, because some of those were not life-critical cases, but there have been lives saved. And there has been a lot of hardship that has been avoided because of the connection that we're able to make with the clinical officers on the ground, connecting them to our volunteer doctors. Are there any volunteer doctors with us? I know we had a few come in. Any on our team right now? We invited some, okay, but I'm sure that we may have one or two later on. But thank you, ladies and gentlemen, and I want to hand over to James. James is our executive director. And he's just come back from Zambia. I'm sure you'll be able to share a little bit of what he was doing in Zambia. James, thank you.
Good afternoon, ladies and gentlemen. Just echo Nagib and David's words. Thank you very much for coming. Really honored to have you here today. As Nagib was saying, I just came back from Lusaka yesterday. Reason for that is we were having a training for a new product, which I might have mentioned for those of you who were at the High Commission event. It's called the ArcLight, and it is a little solar-powered device that is used for ophthalmic investigations as well as ear, nose, and throat. It is going to be something that can be added much better images for ophthalmologists to help them diagnose cases, which is an absolutely wonderful thing because it will help towards the reduction of the 80% of cases that involve avoidable blindness in Zambia. So for this event, we were supported by the Sir Stuart Haley Trust, and we intended originally to go out and visit 290 of the clinics that we currently support, or that our doctors support. But we discovered Zambia is a huge country. It was going to be very expensive to be going around to all these different districts. So what we did was we worked with St. Andrews University and the ArcLight team, led by Andrew Blakey, and one of our volunteer doctors, Nikki Hall, flew in from Scotland. And then we had the sort of logistical nightmare of trying to get 200 clinicians from every one of the 43 districts in the country into Lusaka.
Dr. Nsakanya, Deputy Director in the Department of Clinical Care and Diagnostic Services at the Ministry of Health. Allow me to commend the work of Virtual Doctors, a registered NGO in Zambia and the United Kingdom, whose partnership with the Ministry of Health has helped bridge some critical gaps in rural healthcare delivery. By connecting clinicians working in rural areas to a network of over 200 specialists, doctors currently predominantly in the UK, Virtual Doctors has provided invaluable diagnostic support, continuing professional development, and remote clinical guidance. Ladies and gentlemen, currently active in over 280 Ministry of Health rural facilities across the country, the program has reviewed more than 18,500 clinical cases. The results from a survey among the clinicians are compelling. 92% of patients report symptom improvement, 78% of referrals are avoided, and 97% of rural clinicians gain measurable education benefit from each case reviewed. Such innovation not only strengthens service delivery at the primary level, but aligns our national vision and universal health coverage. I'm particularly pleased with the ongoing efforts to localize the model by onboarding Zambian doctors in collaboration with the Zambia Medical Association and the RDAZ, a critical step in enhancing ownership and sustainability.